Well, welcome everyone. My name is Anasuya Weil. I'm a doctor of Tibetan medicine, or Menpa, as it's called in Tibetan. And I'm here on behalf of the American Tibetan Medical Association, which is a nonprofit organization that's dedicated to preserving and promoting and encouraging Tibetan medicine in the United States. So today we're really fortunate to have Dr. Kunchok Tseten here, who's going to talk to us about the three humors, which in Tibetan is the Nyepasum. And this is especially for people who are interested in Tibetan medicine but might not have any background or understanding. So this is a really important part of Tibetan medicine. And Dr. Kunchok has come to us from Tibet, where he studied and got his master's at the Qinghai University. And then he came to United States, and then he also got his master's in acupuncture and other Asian types of medicine at the Pacific College of Oriental Medicine. And currently he's also a lecturer at Columbia University, where he gives classes on classic Tibetan language. So, and he has an office in Queens, New York. And we're just so delighted to have him, and so fortunate to have him with his wealth of knowledge and his great background. So at this point, he gives classes on classic Tibetan language. I would like to turn it over. He has an office in Queens, New York.
Yes. Okay.
Knowledge. I'd like to.
I can hear you.
Anyways, I am going to turn this over to Dr. Kunchok, Menpa Kunchok, and thank you so much again for being. Also, there will be a 15 to 20 minute period at the end of his talk where people can type in messages and ask questions. And Arik, who is helping us with the technical aspect, will help to choose questions for Dr. Kunchok. Thank you so much.
Thank you. Yeah, then it's my turn.
Yes, please.
Okay. Okay, thank you for the Atma for giving me this platform to convey the basic or the fundamental of the Tibetan medicine. Anasuya just mentioned the three humors, but humor is the best translation of the Tibetan term, Nipa. And I'm going to use the Tibetan term when I'm giving this lecture. And before I'm giving the lecture, I would like to introduce, explain what is the Tibetan medicine. And many people thinking like the Tibetan medicine comes from India or Ayurvedic tradition, part of Ayurvedic tradition, part of the Chinese medicine. But of course, when Tibetan, 7th in the century, the king of the Dharma, king of the Tseten, at that time, the king invited a lot of the doctors, physicians from the neighborhood countries, from China, also from India, and other neighbor countries, and they composed one of the best book, the classical Tibetan medicine book, which we called Soma Ranza, that is like the including all part of the medical traditions. That is one of the oldest the Tibetan medical book. And then we Tibetan doctors using that book and the second book, which we called the Juzhe, the four tantras. That's we call the Juzhe. We are learning Juzhe. And the Juzhe, the first part of the Juzhe is kind of like the short, briefly introducing the Tibetan medicine. And in Tibetan medicine, we are not only teaching the anatomy and the physiology from the Western medicine compared to Western medicine, but in Tibetan medicine, we are not only teaching like that part of like the subject, we're also teaching what is the mind. We just like not separate the physical body and mind. That's in the Tibetan medicine, we have to understand the three bodies systems. So one is the gross body, like the skeletal and the muscle systems. And second is the subtle body. We are talking about like the energetic systems, such as like 3 channels and the 6 chakras, that systems. And the very subtle body is the subtle mind and the subtle wind. That's why you have to understand that if you really want to learn, want to understand the Tibetan medicine, you have to understand that. Otherwise, you can't explain a lot of the signs, symptoms of the disease. At the beginning of this lecture, I'm going to explain about the wind humor or wind nipa, lung, in Tibetan we call it. But it's similar to air, or in Chinese medicine is qi, like it's a little bit similar. But in Tibetan medicine, we catalyze. There are 2 types of the wind. One is wind of the action. Second is wind of the wisdom, intellectual wind and actual wind. And the Tibetan medicine, for like the 3 nipas, we are mainly teaching like the action, but there are some symptoms, psychological symptoms that is more deals to the mind. That's where you have to know like two types of the wind. Then we say like wind is the carrier of the mind. Wind carry mind, then we give it the signals. Then your mind can work and can function. That's why this is the one most important term at the beginner of the learning, interest in Tibetan medicine. Like wind is not like the physical wind. There is intellectual wind. That's the one point. And then I'm going to share my PowerPoint today here. Okay, here. Okay, and the Buddhism too, there are many like the Western scholars and the Tibetan Buddhist like masters, their discussion about the relationship between the mind and the body. And the Tibetan medicine, we can explain a lot of like physical signs, symptoms through the Tibetan medicine, also very connected to the connection between the mind and the body. For example, when we're teaching about the 3 nipas, like the phlegm, which we call the Pekin signs and symptoms, also location of the Pekin, which is located inside the crown chakra in Tibetan medicine mentioned, and that blocked the sensors, 5 sense organs, sensors. And for example, like the second part is Tipa. Tipa is like the body heat, which is located the middle part of the body. And the third is the lung, which is located lower part of the body. The location you have to understand. Then why Tibetan medicine mentions, Pekin is located inside the crown chakra. That explanation comes from the very subtle body systems. When at the 6 weeks of the, the fetus inside the mother's womb, at the beginning, there grew up the channel chakra system, the channel systems, and the one channel goes, grew up upper part of the body. That is the nature of that channel, which we called like the Jamba, which was in Tibetan is Jamba, in English it's called. There is one is heat nature, one is cold nature, one is a neutral nature. The neutral nature is grew up the descending, and the cold nature grew up the upwards, and the one the heat nature is grew up like the middle part of the channel chakra system. So that's why that is at the beginning of the forming the 3 nipas, the nature of the 3 nipas. That's why when we make diagnose like these days many people like suffering from the different types of like the headache, migraine from the Western medicine, and the Tibetan medicine. We just like first thinking about the location of the nipa, and as soon as like we heard some patient said, oh, I have like very serious headache for the many years, like the headaches like sometimes the frontal, sometimes two sides, but no matter the location of like the the pain, but first we diagnose, we think about like the location of the nipa. That's the one part. And for the depression patient, also we thinking about like that location of the 3 nipas, and we can make like a lot of the diagnose. Also, we can give the the treatment through the location of the 3 nipas. Then the cause of the disease, the Tibetan medicine is not directly talking about like the 3 nipa is the cause of the disease. It's not, but their distance and shortness of the cause of the disease. The distance is ignorance. And ignorance called the 3 mental poisons, and the 3 mental poisons called the 3 nipas. That's why the Tibetan medicine always deal with the mind, always deal with the mind. That's when the Tibetan medicine, when we given the treatment, we are not only they treat like the physical signs and the symptoms, also the psychological signs and symptoms through like the medication, also through like the meditation, also through like the unique Tibetan like the treatment, the method, which we call like the mantra healing. That's when all those the different treatments deals the physical body and the mental body. That's why you have to know like at the beginning. Ignorance, the 3 mental poisons, yeah. Attachment, and attachment, which we call in the Tibetan dochak, it's like desire and attachment. And Buddhism, we consider this universe we call the dupikam, the realm of the attachment. That's why like the all sentient beings of this universe are more like have like more desire and attachment. And that's why like if your mind moves something, moves in the direct to somewhere, and that is the power of the dynamic power of the wind. That's why if you have like very strong desire and attachment, that can cause the wind disease. That's the connection. If you ask the questions, what is like the relationship between like the desire and attachment and the wind, because like the nature is similar, because like the wind is the moving. If your desire something, also like you have like that kind of like the movement. That's how we say like the desire and attachment can cause the wind. Of course, like there are many people, especially like this New York City and the big cities, there are like a lot of the competitions, people like suffering a lot of like problems. especially like many people like, like desire too much, then they cause a lot of the physical and mental problems. That's why that is the relationship between the attachment and the wind. Hatred, and if someone asks you if you're like very seriously like angry, get angry, that because like the person's the complexion is suddenly changed to like reddish. That is connection between like the hatred and the bile. Tibetan we call the tipa. It's not talking about the gallbladder, because the Tibetan tipa, there are two meanings. One is the organ gallbladder. One is tipa. That means like the burning. That means like the body heat, because like when you get angry, like that increase the circulation of your blood, and if increase the circulation of your blood, spontaneously they're gonna like increase the body temperature. That's why like between like the bile and hatred, what that is the relationship, because like the nature of the bile also heat, and the hatred also increase like the the circulation of the blood and body heat. That is the connection between the bile and hatred. Then a lack of the awareness, that we call the mu. The mu is in English somewhere they translate to the closed mindedness, lack of the awareness, and that the signs of the symptoms is unclear mind and cloudy mind in the Western term, because like you cannot make like decision. You cannot, you don't have like very clear like visions, very clear senses. That is the relationship between like the lack of the awareness and the if you if you're like increased like this disorders of the Pekin disease, you feel the signs of the symptoms is such as like heaviness and cloudy mind, heaviness of your head, and you become like a fatigue, you become like you become like a fatigue, and you become like laziness, and your senses are not clear. That means the Pekin blocked the sense organs channels. That's why like this is the relationship between the Pekin and the Mu. Then I just mentioned like the location, the different types of the minds, and there are three types of the minds. One is the gross mind, one is subtle mind, one's very subtle mind. Like for example, like the last one, the very subtle mind, and if you're like practice the Tibetan, like the Buddhism, tantric traditions, and you can control like your subtle energy systems, you can awareness like the very subtle mind. That is not like the, or today's topic, but today I just mentioned like these two, the gross mind. The gross mind mainly located the crown chakra. That's when from the second tantra of the Tibetan medicine, the four medical tantra, they mentions like clear the sense consciousness, that the channels which is located inside the crown chakra. That's mentioned in the Tibetan medicine, like the second tantra. That's mainly talking about the gross mind. Then the subtle mind is the heart chakra. That's also Tibetan medicine also mentioned this one. For example, like the differences between the Ayurvedic and the Chinese and the Tibetan medicine, like one point, like when we making like diagnose the disease, the first like Chinese medicine too, in the Ayurvedic too, we are like reading the patient pulse. That's when we reading the patient pulse, the location of the pulse reading, the location for the organs is offsite. from the Chinese tradition and other traditions compared to Tibetan medicine. And Tibetan medicine, like male and female, the heart pulse is opposite. Because like not talking about like the location of the heart organ, the location of heart organ is exactly like same. But there is different, there is one huge difference that many connected to the subtle body systems, which we said like the one, male and the female, there is one channel which is located, the top of our heart organ. We cannot see that, but that one, the direction, and the male and the female is opposite. For like the male is the left side, female is right side. That's where we can feel, we can experience, we can like read through the differences from the pulse. That is mainly connected to the subtle mind. That's one thing. That's where like the if you learn Chinese medicine, then if you come to learn Tibetan medicine, you're gonna be confused about like the location of the pulse reading, location of the organs from your 3 fingers. But if you're familiar with the Tibetan tradition, Tibetan practice, you can figure out the huge differences between the the diagnosis from the Western, from the Chinese medicine and Tibetan medicine. That this one is very important part from the Tibetan medicine. Also, you can explain through like the subtle body systems. It's very important. The gross mind is mainly like the mechanical functions, because like the all the sensors which located like the above the head. That's why we call it like that is the gross mind. That's not the subtle mind. The gross mind, the senses give signals to the gross mind. The gross mind sends signals to the subtle mind. That's where the pathway of like our senses, our minds, or consciousness is there. The different steps, procedures. After then, I'm gonna talk about the wind. Okay, there are 2 types of the wind, and one is the wind of the intellectual, one is wind of the action. From the second tantra, there mentions like the 4 or 5 elements, the function of the 4 or 5 elements. Without air or without wind, there will be no growth, because like the wind is like making like the fetals, all the all the beings grew up by the power of the wind. And then here I have one quotation which is mentioned by like always my teacher use this. For example, Bina sense, because like to make clear, that's why we call it the mind. And it's not enough if you have like clear mind, but your mind needs to move. The dynamic power is wind. That's why long dang sense, wind and mind cannot separate, because they're combined together. That's why you have to know, like, the subtle wind, subtle mind is always together. That's why if you're explaining about, oh, my mind cannot like, work because like laziness and fatigue, that kind of things, it's not your mind. Because in Tibetan medicine, if someone give medicine to treat like the mental disease, that is impossible in Tibetan medicine. In Tibetan medicine, we are not directly treating the mental disease, because like the mature medical, like herbs cannot treat the mental disease. If herbs can treat the mental disease directly, then that is against the law of the cause and the effect. because mind and the body, the cause is the different. That's why we just give the medicine to clean and clear and increase and clean the pathway of our, the energetic system, such as the wind, the nipa, lung. That's why if you're clean, if you're smoothly increased the energetic systems, your mind spontaneously will be clear. That is the one point. We are not giving medicine to the mind. We are giving the medicine to the location of the location or the pathway of the mind or the consciousness. That's why the wind is important. Then why wind is important? For the third, the Tantra, at the beginning of the first chapter, they mentions about the wind nipa, wind disorder disease, because wind is at the beginning or end of all types of the disease caused by the wind, also concluded by also the wind, which says preceding, concluding, and dispersing and spreading disorders. For example, this year in New York City, and we suffered a lot about novel COVID-19, and many patients, I saw a lot of the patients about this type of the infectious disease, and the end of the disease, because even the Western medicine confirms as a negative, but the patient have a lot of the signs, symptoms of the wind nipa, for example, sleepiness, insomnia, and fatigue, and also coughing a lot early in the morning and night, and sweating a lot. This type of symptoms, and from the Tibetan medicine is the lung sepa, because the deficiency of the wind or complicated wind. That's where in Tibetan medicine, we always focus on at the beginning or mid or end of part of the treatment, we always focus on the wind. Wind is the preceding and concluding and dispersing and spreading. That's why at the end of pandemic disease, also we take care of the wind. In Tibetan, we call it towie long, because the wind cause a lot of the disease at the end of the treatment. That's where one point, wind is important. That's what the beginning too. Then there are 5 types of the wind. The life-sustaining wind. Actually, there is one point in Tibetan medicine, and the location of the life-sustaining wind is the crown chakra in the head. But from the tantric tradition is not mentioned this location is a little bit different. And the tantric tradition is said inside the heart organ, heart chakra. That's why this is the tantric mainly utilize or active the subtle body systems, but in the Tibetan medicine mainly focus on the signs and symptoms of the gross body. That's what these are the differences about the location of the life-sustaining wind. For example, in Tibetan tradition, many Tibetans, they're very familiar. Okay, solong, long. But whenever someone have different mental disease, then Tibetan doctors and the Tibetan people say, oh, that is a solong, life-sustaining wind, because we know life-sustaining wind is the one of the most important wind, and the function of the life-sustaining wind and makes conceive the pregnant and the growth, development of the fetus by the power of the solong from the subtle body systems. And the gross body, we also focus on the life-sustaining wind. whenever you have like, stress, anxiety, and depression, we always say like, oh, so long, so long, so long. So is life, long is the wind. The wind, the power of this wind, holding the life, holding your life. That's why this wind is very important. Then location, the resides in the head and governs all the body systems, especially it functions auspicious, helps to swallow food, breathe, sneeze, and vomit, and belch, and clear the mind and the sensory organs. That's why this is important. Why clear the mind and the sensory organs? There is one important, I just mentioned before, why the function of the life sustaining wind can make, can clear the mind and the sensory organs, because the location of the life sustaining wind is the crown chakra, and the sensors, the sensory organs, the sensors, the consciousness, sensory organs, mostly located also the crown chakra, located at the head. That's why the function of this wind specifically clear the mind and the sensory organs. That's why a lot of the Tibetan doctors, the depression, disease, we diagnose the life sustaining wind. There is one. This is the one reason. This is like when the life sustaining wind, what kind of the cause and what kind of the symptoms if this life sustaining wind is disordered. Like here is mental instability and difficult inhaling and swallowing. This is because like they were inhaling or swallowing or speak, all the functions comes from like our brain. Because this is in Tibetan medicine also, like, we are not talking about the brain, the nervous systems, but we are talking about the dynamic power of the, the life sustaining alone. And one most important, the type of the lung is pervasive. And a pervasive wind, which is located inside like our heart. Some, the tantric says the life sustaining wind is located in the heart. Anyway, but pervasive wind in Tibetan medicine is located in the heart. Because the pump the heart, increase the circulation of the blood, also the our movement and our speak, all the movements, all like, the actions and the signs symptoms, which is like the more movement related, the comes from the pervasive wind, especially like, cardiac disease, heart disease. Also, all the Western medicine, all the Western medicine, like, diagnose a lot of the heart disease. Also in the Tibetan medicine, we focus on the pervasive wind. For example, at this time, the COVID-19 and the end of like the patients, like, like 1 month or 2 months, then the test is negative, but few patients, I have a few patients, they're suffering from like, very fast heartbeat. That is the disorder of the pervasive wind, because like the patients, the wind is more complicated. That's why I treated by the formulas, which we called the Songjin Chechu and Ake 35 and Bumala and Chimel Arjil, like a few different types of the Tibetan, classical formulas. I treated by like, Tibetan medicine, because like that is the orders of the pervasive wind. Then, for example, like if the pervasive wind is disordered, then there is the symptoms, look, such as a sensation of the heart being twisted, fainting, talkativeness, restlessness, or fear and panic. Like this type, if the, if you hear unpleasant words, like then very stimulate or very immediately you get like unbalanced of like the pervasive wind. Not only the pervasive wind, also like the general like along the wind, like caused by like the hearing unpleasant like words. That is the one key we make diagnose like the patient's the disease is the wind nipa, wind, unbalanced the wind. Then this type of like, the treatment for like treatment, we use not only use like the herbs and external therapy, we also use one important lifestyle. For example, like, for the lung disease, okay, the patient, if suffering from like the lung, like mental or lung disease, the best solution or best treatment is spend time with someone who gives you like positive energy, like the like attractive like friend or partner, or that's why the wind is caused by like the unpleasant words. That's why we always say like, okay, you should listening like the music, you should sing songs, you should like spend time with like the the friends who always gives you like the positive like the energies. That's when the West medicine and the patient they're sent to like a psychologist, and they just talk, and they just share like the the through this way give the treatment. But in Tibet we not only like share like a personal like mental problems like lifestyles, all different types of the problems share with the Tibetan doctor, also share with the friends. Also we do have like some spiritual masters, like if you're like believe, trust someone, authentic teachers, authentic masters, then they just go to there and they get like a blessing. Not only get a blessing, also they just like give, they just get like some kind of like instructions to free from that kind of the suffering. That's why one one start, and then here the ascending Jianji alone. The ascending wind is like located in the chest. When in the Western medicine, we're talking about like autoimmune disease, like the thymus, which is also like located in the chest. That's when the Tibetan medicine, we when we talking about like the constitutions, like for example this one for here, like when we are not only diagnose disease from the pulse, urine sample, and complexion, yeah, and ask questions, but there's one unique like part, and Tibetan doctors always check, always look at the patient's the the readings, which we call the dang. Dang is the seven body like constituents, like at the end of the seven, that is the kawa, is the drops, and the essence of the drops is dang, is readings. If someone who has like very brilliant and very clear readings, we consider that patient physically or mentally is healthy. That is, in Tibetan medicine, it mentions like the maintained strength and increase readiness. Also, the function of the thymus too, there's the mentioned strength and increase the readiness. That's why Tibetan medicine not talking about like actual like organ systems, but we are just to mention, we are just to focus on the power like ascending wind. We try to give the medicine to increase the function of the ascending wind. If there's a deficiency, if there's a complicated, we try to reduce and balance the function. Then the Menyimge Long. Menyimge Long, which is located the stomach and intestine, and mainly works for the digestion of the food. It helps like digest the food and absorb the nutrients, and also transports the food essence through the body, because like some patient, their appetite is very good, and they think their digestion is pretty good, but they're still like skinny and fatigue. There are a lot of like the sign of symptoms, and they don't know what is the cause of the their like a disease. And the Tibetan medicine, if patients like complain like that kind of like symptoms, we always focus on the Menyimge Long, or there's something wrong, because like they cannot absorb the essence of the food. That's why you have to focus, you have to treat the Menyimge Long. And we can diagnose through like pulse and urine, but this one you have to ask questions to the patient, like patient's lifestyle. That is one important. The last one from the 5 types of the wind is a descending wind. And for the descending wind, there are many people suffering the enlargement of the prostate and the frequency of the urination, and not only male and female. And if like you're getting old and people hard to control like your urine, that is in Tibetan medicine, we always focus on the descending wind. No matter it's enlargement of the prostate, the prostate enlargement we can treat. Tibetan medicine is very effective because we always focus on the descending wind. And some, for like my teachers, they're giving the medicine to the, Tengwa or Kema, the kidney systems, like tonified kidney systems. But meanwhile, we just give the medicine to, increase or treat the descending wind. Those 5 types of the wind is they're working like the physical body, also psychological part of our body too. And then there are another 5, minor. That is from the, not only from the Tibetan medicine, also from the Kalachaka, it's like the highest, in the yoga of the Buddhist tantric tradition, also mentions the name and the function of these 5, minor winds, because like they give the name is like turtle, yeah, and different animals name, but I don't know why they give the different animals name, but there are many works like clear or more function like this, or sensors or sense organs. For example, from the here, Jibe is a turtle, resides in the airs and helps perceive sounds and movements of the extremities. For example, like if someone has like air problem, then we always focus on, not only focus on wind, but from the wind, the type of the jibe, which is located inside the air. That's why we give like the medicine to like the wind. For example, the tinnitus, like we always like the focus on like the 1 point hypertension, 1 is the the pressure from the air, 1 is the kidney wind, kidney lung disorders. That's why always that is connected, this is a wind, but not to mention the specific wind, but always that is connected to the wind. It's like in Tibetan medicine, it's very details, not only talking about the 10 types of the wind, but it's very detailed. it covers all part of the body. Here,
Menpa, I just wanted to interrupt for 1 second and say we have about 10 minutes left in the meeting.
Yeah.
And there's been no questions yet, though.
Okay. This is one picture. I just, I think this is from the Dharamsala, Tibetan, Mensi camp. And this is the kind of like when we given the moxibustion. For example, like for the wind disease, the best external therapy is chukpa. It's like the oil massage and oil moxibustion and the real moxibustion. That's where we give the different points from the front end and the back points of the which more connected to the each organ systems. Yeah, but for example, like the wind, general wind, the point is which is located the first, the thoracic one, number one. Number one is you can use number one to all types of the wind disease. Actually, there is one contradiction, and some like the Chinese medicine, because I studied Chinese medicine from Pacific, they always give the moxibustion, but in Tibetan, when you're giving like moxibustion, for example, if the patient is young age, for example, a student or kids, you cannot give the moxa to the patient. The patients, the general wind and the thoracic 6 and 7, you cannot give. And also the front in Chinese medicine called the Ren 17, but the Kanakchan, the middle of the the chest, you cannot give this points, because the if you give the moxibustion to that points, it's gonna diminish the patient's memory. That's why. Yeah, because that is, you have to know, because that point is the pathway of our dynamic power of the wind. Also more connected to like the nervous system and heart organ. If you give like strong moxibustion in that area, it's not a good idea. That's one thing. And in Tibet, also these days in the Western country, many people like to practice yoga. But there are two types of yoga. One is physical yoga. For the practice of physical yoga, it's okay. But for practicing the tantric yoga, you cannot give the moxibustion to that person. If you give moxibustion, it's gonna be blocked the channel systems. That's why you cannot control. You cannot active the subtle energy systems. That's why that's the two most important points. And one thing is, if you have stress, anxiety, and depression, you don't need to give the moxa. You just prepare a few things like nutmeg and the sesame oil. The nutmeg oil and sesame oil mixed together. You just heat the oil and you just apply, upper part of the body and the front, your chest, for just leave 15 or 20 minutes. And after then, you should take a shower. That is the best solution, for people, you come for me, for the insomnia and the stress, depression, that kind of a lot of symptoms. You don't need to take any medication. You just to do that kind of the treatment. It's going to increase the sleeping function. Also, it's going to balance your wind. Meanwhile, you have a very clear mind and calmness. That is the one point from the wind. Then, when you're making diagnosis and Tibetan doctors, for wind disease, the Nipa Long, for what kind of like, things, food and lifestyle, bring wind disorders. Like, look, and I don't know here, but in Tibet, like many Tibetans, they like to practice like Buddhism, and one is fasting. Fast many times for the long time. That is one thing can cause. And another thing is like working or exercise or working like empty stomach. And one thing is not sleeping properly. There are many patients, especially like the college students, because like they change their time. That's where they do have a lot of like, the stress, anxiety. It's not only from their, work, their study, but they changed their lifestyle. And another thing is for like in Tibet, and in the monastery is like a university. Like they're studying medicine, they're studying astrology, they're studying like, Buddhist dialectics, the meditation, but they never charge the fee. And you can request any teachings from the, different teachers. They're constantly teaching, giving teaching. Then they get a lot of like, wind disorders, especially like TMG. Yeah, there are many patients, there are many monks, they're suffering from the TMG. Also the college professors too, they're also suffering from TMG. And TMG also one, type of the wind disease, which we call Jamba, decrease the function of like your jaws. Also, with the sesame oil and the nutmeg oil, warm that oil and just apply this area, also effective. This I learned from my practice, because like New York City, many patients, they're suffering this type of the disease. Then thinking too much. Okay, there are two lifestyles. One is physical body, you're working too much. And one is mental activities. If you're thinking over beyond your, limitation, then you get like this kind of the disease. Then under stress or tension, that is like very common. Like for the food, and generally speaking, there are two types of foods. One is the food which is like your system get use it. One is not get used it. For example, I'm from Tibet. For like yak meat and milk and butter and cheese, that kind of like, also the Tibetan samba, all those like foods for like my system, it's get used to food. Even I have like, packing disease, digestion problems, I cannot cut down. I cannot give up like this kind of the foods, because even like these foods harmful your disease, but we give a small portion to the patient. This is the one key. And a lot of the Asians, when they are moved to the Western countries, they just like give up their like lifestyle, like the, the food, they just like, changed, then they get a lot of the problem. That I noticed from my practice, because for example, people from the Tibet, Himalayas, we get used to drink hot water, because like our internal system changed by the external change. This is from the Tibetan medicine, also Buddhism too. For example, like you're living like high altitudes, the weather is very cold, you need to, get more warm foods. That's why your body systems get used to warm foods. But when you move to this country and you change, you just drink ice water, ice coffee, it's big problem. Then you get like, a lot of the disease. For example, if you change your diet suddenly, then for example, you drink a lot of ice water and, ice coffee, that kind of like very frozen foods, then it's gonna be, harmful to your digestion. And in Tibetan medicine, we say all the internal disease comes from the indigestion. That's why we always protect the digestion systems. It's the one key. Then,
Menpa Kunchok, we're almost done, and I wanted to ask you, because you're talking about lung, what do you think about, there's so, we in the West spend so much time in front of computers and on the screen, and if you've seen what kind of an effect this has.
Okay, then, yeah, you're a Tibetan doctor. I think you're familiar with this from the second tantra.
Mm-hmm.
Cause and the effect of the disease. This says like if your senses, for example, someone using computer too much, always use a computer and then decrease the vision,
Mm-hmm.
that is one point, because like your sense using too much. If you're never using, then big problem. If you're using too much, then big problem. Understand that?
Yeah.
Yeah, that is like the lifestyle.
Yeah.
Yeah.
So do you have, before we have to end, do you have any particular advice for people just to manage their own lung, and if they're not familiar with how to do this?
Many people are not familiar about like the lung in Tibetan term,
Mm-hmm.
but they're familiar like the Western term, like the symptoms.
And if they're not familiar.
Yeah, then I say like if you practice yoga or meditation, if you just practice like, the single point of the meditation, no matter like, you're a Buddhist or not, you just like, focus on your mind, one single point. That is the unique way to reduce or balance the dynamic power of our movement, such as which is the wind. That is the best way. Also, if you cannot do that, some patients cannot do that because like they're too much wind, then you have to drink bone broth, mix different types of the bone and cook it, and you drink that. That immediately can balance the wind disorders. And the best solution is you have to spend time with, the friends who give you positive energies. That's the one point. That's from the Tibetan medicine, like, the lifestyle, can affect your physical body and also mental body. Any questions? No, I can't hear you.
Sorry.
Right. Yeah. No more questions, yeah? No?
I think.
There wasn't any questions on Facebook.
Okay, yeah.
Okay.
Yeah.
Yep, someone is asking about therapeutic oils.
Yeah. Okay, no matter the oils, the foods, like the beans, yeah, the the wheats, if the fresh, yeah, if it's fresh, it's good for the wind disorders, because all types of the foods, if during the time of the fresh, is the taste is sweet. Sweet comes from the earth and the water. Yeah. Yeah. Also, the sweet can balance or can treat the wind disorders. That's why.
Great. Yep. Thank you so much. Thank you.
Actually, I want to my plan is to cover the 3 nipa. That's why today's only 1 nipa long.
Yeah.
That's
well.
best.
we would love to have you back and to do this again. So let us, if you're willing,
Yeah.
perhaps we can make a date and have you come back.
Okay, like
this
using my
been...
English, sometimes it's difficult.
Yeah, well, thank you so much. This has been really, really lovely to hear you, and you've been very clear, and I'm sure that a lot of people have benefited from this. And so, yeah, on behalf of Atma, I'd like to thank you. And if anyone is interested in seeing this, it'll be available on Facebook. And also, you can check out Atma at American Medical Association.org and see also some of the other things that we're doing and we're up to. And once again, I'd like to thank everyone for being here with us today. And I hope it's been helpful.
Yeah.
And thank you to Eric for doing all the technical things, because that has really been, that's beyond me. So thank you.
Okay. Bye.
Thank you. Thank you, Menpa Kunchok.